Do you really need a full knee replacement? Or could a half knee replacement, also called a partial or unicompartmental knee replacement, be the better option? Many patients are told they need a total knee replacement without fully understanding the alternatives. But here's the reality. For the right patient, a half knee replacement can feel more natural, recover faster, and preserve more of your normal knee. On the other hand, a full knee replacement may last longer and is often more reliable in advanced arthritis. So how do you decide? Today, I'm going to explain the differences between half and full knee replacements, who is suitable for each, recovery expectations, risks, long-term outcomes, and what the latest scientific studies actually show. A half knee replacement replaces only the damaged part of the knee. Usually, this is the inner side of the knee, called the medial compartment, although sometimes it can involve the outer side or the kneecap joint. Importantly, the healthy cartilage and ligaments, especially the ACL, are preserved. A full knee replacement replaces all three compartments of the knee. The damaged joint surfaces are removed and replaced with metal and plastic components. So who is suitable for a half knee replacement? This is where things become important. A partial knee replacement is only suitable in carefully selected patients. Typically, the arthritis must be confined to one compartment. The ACL should be functioning, the deformity should be correctable, and the remaining cartilage should still be reasonably healthy. If someone has widespread arthritis throughout the knee, then a partial knee replacement is usually not appropriate. A major BMJ systematic review and meta-analysis comparing unicompartmental and total knee replacement concluded that both are viable options. But patient selection is absolutely critical. So, what are the advantages of a half knee replacement? One of the biggest advantages is that the knee often feels more natural afterwards, because the normal ligaments are preserved. Many patients say the knee feels less artificial compared with a total knee replacement. A recent systematic review and meta-analysis also suggested that unicompartmental knee replacements may produce a more natural-feeling joint compared with total knee replacements. Another advantage is faster recovery. Studies have shown shorter hospital stays, quicker return to work, and faster return to sporting activities. The BMJ meta-analysis showed quicker return to work and sport after partial knee replacement compared with total knee replacement. The surgery itself is also generally smaller, with smaller incisions, less bone removal, lower blood loss, and less disruption of soft tissues. Many patients also achieve slightly better range of movement and more normal knee mechanics. However, there are important limitations. Firstly, partial knee replacement is not suitable for everyone. If arthritis later develops in the remaining compartments, symptoms can return. Secondly, partial knee replacements have a higher revision risk compared with total knee replacements. This is one of the most important points patients need to understand. The BMJ meta-analysis showed that total knee replacement had lower revision, R18s, than partial knee replacement. In simple terms, partial knees are more likely to require another operation at some point in the future. Another important factor is surgeon experience. Outcomes for partial knee replacement are highly dependent on correct patient selection and surgical expertise. Now let's look at the advantages of total knee replacement. A full knee replacement remains the gold standard for advanced arthritis because it treats all compartments of the knee. Advantages include reliable pain relief, lower revision rates, suitability for severe deformity, suitability for inflammatory arthritis, and predictable long-term outcomes. Registry studies consistently show lower revision rates for total knee replacements compared with partial knee replacements. Recovery also differs between the two procedures. Patients undergoing partial knee replacement often find the initial recovery easier, with less pain, quicker walking, and faster return to activities. A total knee replacement is a bigger operation and recovery can involve more swelling, stiffness, and rehabilitation. However, a full knee replacement may provide a more definitive long-term solution in patients with advanced arthritis. That said, Recovery varies enormously between individuals. Even a partial knee replacement is still major surgery, and most patients continue improving for up to a year after either procedure. Both surgeries also carry risks. These include infection, blood clots, stiffness, persistent pain, nerve or blood vessel injury, and implant loosening. Partial knee replacement also carries the additional risk of progression of arthritis in the remaining parts of the knee. So, which operation is better? The honest answer is that neither is universally better. The best operation depends on your pattern of arthritis, age, activity level, ligament status, deformity, expectations, and surgeon experience. If you have isolated compartment arthritis and meet strict criteria, a partial knee replacement can be an excellent operation with very high patient satisfaction. But if arthritis is widespread throughout the knee, a total knee replacement is usually the more reliable and durable option. A good surgeon should not simply ask, "Do you want a half or a full knee replacement?" The more important question is, which operation is best suited to your knee? Getting the indication right is probably more important than the implant itself. If you found this video useful, subscribe to the channel, share it with someone considering knee replacement, and let me know in the comments whether you were offered a partial or a total knee replacement.